This is the April 24th, 2023 meeting of the Boulder County Regional Opioid Council. And Commissioner Levy had a conflict, which she notified me about, but I didn't, I got mixed up about it. So she's actually conducting a public meeting about our ARPA program with our ARPA staff. So that's conflicting with this meeting. And then Boulder City Manager Nuria will also not be able to attend today. But I believe we've got everyone else. So welcome, thanks for your time. And I'm going to pass it over to Kelly for her PowerPoint to get on the screen and then to begin with our agenda.
Great, thanks, Robin. Let's just give me 2 seconds here. This is a little bit of a different format. Can everyone see my slides?
Yep.
Okay, perfect. So as Robin mentioned, welcome to the April meeting of the Boulder County Opioid Regional Council. So as just a quick recap of our agenda today, and we're going to start with our virtual meeting guidelines. So first and foremost, thank you to any members of the public that are joining us here today. As this is a public meeting, but not a public hearing. So we are not allowing for public comment or interaction in the course of conversation. We do welcome any comments, concerns, sort of questions to be put into the chat, but with recognition that it will not be formally introduced into the course of the conversation with the council members today. So for our agenda today, we're going to start with a discussion of current opioid trends that is going on across our region by Commander Nico Goldberger with Boulder County Sheriff's Office and the Drug Task Force. We're also going to follow up on some conversation that we started in our March meeting around the possibility to test wastewater in the region for opioids and what that might tell us, what the scope of that might look like, et cetera. I will be giving an update on our selection process for our request for proposal. We have mentioned this in the last couple of meetings about putting out an RFP for assistance with facilitation and evaluation work. And then we will also be welcoming Jack Patterson and Jamie Feld with the Colorado Opioid Abatement Council at the Attorney General's office to talk a little bit about some important updates from the state level. And then we can close out with any other items for the good of the order. So that said, I will pass it off to Nico to get us started. Nico, I can just continue to advance these slides for you if that works.
That would be perfect. Thank you very much. We can move to the OD map. Good afternoon, everyone. I wanted to give you a little brief update and understanding of what OD map does for Boulder County as a community itself, with this helping with public health and other treatment and preventative options out there. So OD map was designed by High Intensity Drug Trafficking Association out east. It's a federal entity that law enforcement, medical responders, as well as emergency departments, EDs, can input information. And let me backtrack. I want to talk about the information I'm talking about is information of people who have either passed away or were saved by the use of naloxone or other medical resources. So I want to say we're talking about lives here. So when I say data, I do it with all the respect because people have passed away when we're dealing with this platform. So how this works is when law enforcement, at this point, law enforcement responds to an incident, they can add data information into OD map. This gives us a live time opportunity to see what is occurring in our county because all the law enforcement agencies in Boulder County are signed up for this. I'd like to say that Boulder County is the only county in all of Colorado where every law enforcement entity has signed up. We're also the DA's office, coroner's office, working on Boulder County Public Health. They're working out some of the minutia on getting that going. So this county is actually up to speed and really doing well on that. So I give your attention to the map that you see in front of you. On the right side is the legend. The diamonds indicate that somebody has died. The circles indicate that somebody did not die. The different color coding shows that whether naloxone was used. One of the common trademark names is Narcan. Another one out there is Cloxato, but Narcan is a word that you've seen or heard many times. So the diamonds do show the deaths and whether Narcan was used, not used, how many administrations. The bottom left shows you a few numbers. Total suspected overdoses. Now, this is not official. It does not come from the coroner's office. This information is showing that when law enforcement responded on the scene, they suspect that probably some type of overdose, whether it was, let's say, fentanyl or another drug, alcohol, or anything else, if they think it was present. Currently, year to date, that number would be indicating 46 persons. The next part you see down there is fatal. Right now, year to date, there are 10 suspected fatal overdoses. Again, not official until the coroner's office give us their information. And lastly, at the bottom is the naloxone use. So whether law enforcement responded or somebody, a civilian, attempted to give Narcan or naloxone to somebody, this would be documented in this, and then we could see how many people were affected. Again, not official. That goes to the coroner's office for all that. What we'll see, though, is how it is detailed is we put down an address. That address is encrypted. Nobody can see it. But then you'll see all those different addresses, excuse me, I should say diamonds or circles throughout the county map, indicating the jurisdiction. Of course, we've had deaths in every jurisdiction, law enforcement jurisdiction. Primarily the larger jurisdictions from Boulder, Lafayette, Longmont, and a few. The 19th and 20th of this month, Boulder County did have 2 fatal suspected overdoses. Boulder Police Department had 9 incidences since the 10th, and thank gosh, none of them were fatal, but they were 9 incidences since the 10th of this year. With those, 6 are suspected to be fentanyl, 2 alcohol, and 1 is an unknown, excuse me, as I look at my notes. That is the general gist first on what OD map is, and with this live data, public health, other treatment and prevention agencies can use that information to find out where there are places are occurring, maybe more so, the frequency, and maybe think of ways to tackle this and think ahead for giving things such as we've talked about vending machines in different locations, items of that sort to help give our community members the treatment. Go ahead on the next one, Kelly. So on this, I want to give you a little bit of information on the trends that we've been seeing lately. For the past few years, and right now I'm going to talk about those M30 pills. Those are the ones that are suspected to be containing fentanyl, and they have been. Past few years, we've been seeing a cost on the street between $5 and $20, right? Current cost now is drastically lower. You can easily find these pills even $2, or if you buy in bulk, unfortunately, you can get it even cheaper. Why? It's supply and demand, and everything with our these how should I say, these cartels. These cartels are getting very good at the distribution network that they have. They are very efficient, and with more time as they go, they pick up more drug traffickers and drug dealers to sell their product, their wares in any state. Colorado, of course, is one of them. A large amount, of course, because the supply and their distribution is coming up primarily from Mexico and coming up towards our location. Other competition to keep the prices low, of course, is the different drug trafficking organizations around the state, but also there is person-to-person dealing. And then, of course, there's the internet, which you've been hearing about very frequently. That also drives costs down. One of the other drugs that you've probably heard about as well is xylazine. This is hitting the West Coast, the East Coast, and it will come to Boulder County. We have not seen xylazine yet in any coroner's reports, but I can guarantee you, unfortunately, that is coming. Xylazine is an animal tranquilizer. So what happens is they normally mix, and when I say they, I'm just going to blame this one right now on the cartels. Some other people can do it by themselves, but the proportion is the cartels are mixing opioids, primarily fentanyl, with xylazine. They give both a very similar effect, but if you give Narcan to somebody who is on the opioid and the xylazine, the Narcan, naloxone will assist, hopefully reviving the person referenced the opioid, but it has no effect at all on the xylazine because it's a tranquilizer. And that is why it's so imperative that people still get medical treatment, because whether the naloxone wears off or the xylazine is not treated, people can die. If I did not mention it, there's been 4 overdoses in the Denver area that are associated with xylazine. None here, none in Boulder County. Frequent names that you have that you'll hear on the street, the primary one is Tranq, and that's because it is a tranquilizer. Then I want to touch a little bit about what we're also seeing down here on cases that Boulder County has had. Months ago, we had an active, months ago, the Drug Task Force and the DA's office partnered on a criminal investigation against Mr. Valdez. We charged him with manslaughter and fentanyl because of the fentanyl distribution, and he was convicted. We currently have active prosecution against multiple different people as well, some of which are for manslaughter, partnering with the DA's office. And then lastly, last week, you might have heard of the prosecution of a Longmont gentleman, first and last of Tantan. He was convicted on multiple charges, drug charges containing or related to fentanyl and methamphetamine. Why I say this is important is because the equipment that was successful or helped in the conviction of these people is the equipment that I've asked for with the opioid litigation fund, the approximate $95,000 a year out of each year. It's looking like at 1.7 mil, we're doing 95. This is helping the community members around Boulder County, giving a successful prosecution. Now, I gave you a whole whirlwind of stuff, and I passed over some things that you might have questions. So is there any questions that I can answer or any research I can find out and get the answer for you?
Susan, I see your hand.
Thanks so much for the information. I wasn't able to see the map very well. I don't know. I was trying to zoom in on it. Is there a way? Will you be sending this out? Did it get sent out and I just didn't see it?
It hasn't been sent out yet, but I
Okay.
can send them afterwards. Yeah, and I know Nico and me, you could probably speak more to this. It wasn't populated with any localized data, so it was mostly
okay.
just so it was sort of more of a static image to show you what ODMAP is, but it and I'm not sure it had any actual data on it.
No, I did not have the data on there. That there's we cannot give people access or see that. It's just the contract we have with ODMAP. The partnering agencies, law enforcement, coroner's office, DAs, Boulder County Public Health will be able to see that data when they are all signed up. Then they can share that information with the preventative and treatment facilities all over, right? Saying, hey, we've had a high rise of something occurring in this area. Let's come up with a plan to battle that and see what we can do. But yeah, you will not see that. And I want to focus again is you will not see addresses. You'll see very general areas where an overdose occurred of some sort, right? It does not delve down into the minutia of the address of at 1234 Main Street. Never gets like that, and it's also encrypted. So that information never comes out.
And this is just a second question. It's a little bit naive probably on my part, but just as far as the law enforcement cases, I'm assuming these are all direct distribution cases and that I understand that law enforcement is probably looking for the source. How often are they successful in finding the source, whoever is making the drug and has a broader distribution of it?
And that's a good and hard question. Time is life, and I mean that seriously. If we can, let's say hypothetically, we can get a phone from a victim, or we're able to arrest the drug dealer and get into his or her phone quickly, we have better chance of doing that. And that's what this equipment does. I can't give you a hard number, but the equipment gives us the chance to do it. Without this equipment, with whether it's a locked phone or it's been turned off and we can't have access to it, we will never get the information to find out who the other source of supply is. We'll never get enough information to give enough to the prosecution to charge different criminal charges against these drug traffickers, because that's where most of the information is hidden, is in the phones, or I should say digital platforms, computers or anything else.
Thank you very much.
You're welcome.
Nico, I know it's early in the game, and I know you don't have a crystal ball, but I wonder if the increase in overdoses is indicating, a potential increased threat, and will we see more? And is that what the law enforcement agencies are worried about? And is there a call to action related to that beyond what's already happening?
I think we are at we have done so much for the notifications to the public about the drugs in our community. It's almost can't get any clearer than that, except we can keep repeating the same message. We keep battling or trying to find out these drug traffickers are. When we take one off, 2, 3, or a whole group, there are more back there, right? So the law enforcement part of this is we will never stop the drugs from coming in. Prevent to me means stop. We will not prevent, we will lessen the amount of drugs coming into our community, meaning we will lessen the chance that somebody could die, or give a better chance that less people will die, if that answered your question. But it is never ending.
Understood. Thank you. Are there any other questions for Nico, or wonder if anyone wants to share their perspective and observation, what's happening locally that you're seeing? And then the final question Kelly and I had is around, are these sorts of updates useful? And how often should we be bringing them forth? I think the secondary interest on our part is, again, just putting real-time names, not people's names, but that these are people's lives. And if you remember, our first ROC meeting had a person with lived experience. And so we want to periodically check in that way as well. So welcome any observations or comments about how often we should be reviewing the local scene.
I wonder about quarterly. I don't know how often the data changes, but I wonder if quarterly might be good.
Thanks, Susan. Lexi, you have your hand up?
Yeah, Nico, thank you so much. This was a really helpful presentation, and I think we're already seeing the dividends of investing in the ODMAP collaboration. We've recently had some unfortunate incidents, as you mentioned, in our community, and from public health's perspective, it used to take a really long time, sometimes months, to get the information back. And, I feel like we're at the beginning of the exploration of what this technology can do to support us to be much more nimble and responsive to our community needs. And I would just encourage us to continue to think creatively about how we can use the information, really advancing, recognizing that needs may change over time, that this is a very dynamic space. and that new needs are occurring, and we may find that new solutions are needed too as we begin to move into response modes more quickly. But thank you very much for this. It's beginning of what I hope will be a really useful tool for us.
You bet. One thing I did forget is to inform you. We started inputting data into OD Map September of last year. So I can't give anyone a real comparison on what it last year was compared to this year. The only thing we can unfortunately do is look at the numbers from the coroner's office. But this is a first great year where all the agencies putting in that information will help give you guys a roadmap of where we are live time for the decisions that you make.
Thanks, Nico. Were there any other thoughts, observations, questions, or comments before we move forward?
Sounds like there's consensus about reviewing this data, and maybe we'll start with quarterly. And then if we have, some explosion or emerging issues that come up between those quarters, we could bring it to the board.
Thanks again for joining us, Nico.
You betcha. You take care, everybody. Have a great day.
Bye-bye. Okay, so next up, we did want to review a conversation that we had started in our March ROC meeting around the possibility of doing some testing of the county's wastewater to see, sorry, I keep getting email alerts, to see if there's any rising trends, spikes, prevalence that we can sort of zero in on particular hotspots of opioids that are kind of coming up in the wastewater. And so just a quick reminder of what this project entails. So the background is really that wastewater testing has been an ongoing effort, and specifically during the pandemic, there was an increase in testing wastewater to identify communicable diseases such as COVID. The hotspots, the trends, again, sort of spikes so that we could figure out, are there areas that we want to target our resources or have really targeted initiatives, or how do we evaluate what's going on over time? So that translates forward to today when this technology is really being expanded to test for opioids within wastewater. And so what that might look like is, fentanyl traces coming up to identify where these drugs are appearing within our community. And that could point us in the direction of having a more tailored approach to sort of tackling that in those specific areas. So after our March discussion, or I should say during our March discussion, really the charge from the council was, to go and investigate this a little bit further and see what are we really talking about in terms of scope, opportunities, bring back some use cases. So where is this actually, this testing being done to identify opioids in wastewater, and what are localities doing with this information? So a little bit more of the answer to, to what end, and then bring back an understanding of financial and staff capacity that might be required to launch or stand up an initiative like this. And then finally, the ROC provided the feedback that they would like this to also be a conversation that the Opioid Operations Group holds. And we are meeting this Thursday, so we can carry forward both the March and today's conversation to that group for subsequent discussion. So really with that charge, we went and investigated with two primary sources, both BioBot, which is the MIT-based organization that really leads and is advancing the use of this testing technology, as well as our local, or I should say our state partners up at Colorado Department of Public Health and Environment, CDPHE. And so before we kind of go into those two viewpoints, just wanted to have a slight caveat and mention that this is definitely a conversation with many different perspectives and points of view, and really just kind of, again, echo that we're bringing forward this information from a neutral perspective so that council members can feel more informed in having a conversation of whether or not this is a good fit for Boulder County to pursue. So first up, the summary that we got from our partners at CDPHE was that this is, potentially an opportunity, but there's some serious sort of drawbacks to be considerate of. For CDPHE itself as an agency, there are some funding restrictions. So the Centers of Disease Control at the federal level are not allowing CDPHE to fund any efforts around wastewater testing for opioids. So at this time, it doesn't seem like there is any clear path for how to fund or sustain this effort should CDPHE determine to take that on. Also, some expressed concerns around the drawbacks to the testing capabilities. So some ethical concerns around whether or not it would stigmatize certain neighborhoods or regions if we're really drilling down to see that, opioids are spiking within said region or neighborhood. So a few concerns about what that might do at that ethical level. There's also some concern that this is not really tested, proven, vetted quite enough in order for it to really be tied to any cohesive public health response, either at the state level or any of the sort of local levels of public health initiative and response. Also, some concerns that testing for opioids in wastewater doesn't allow us the ability to distinguish between valid use of opioids that might be showing up in the wastewater, such as prescriptions, versus invalid or illicit use. So again, some concern that we're not really going to be able to get at that question of, to what end, what is this data really telling us, and how is it meaningful, and how can we act on it? And there was also some conversation about alternative testing sources. So we do know that the state has surveillance data that has been in use by our public health partners. We also know that there are improvements coming to various state data dashboards. Both the CDPHE as well as the Consortium for Prescription Drug Abuse Prevention are building out more of the indicators that are reflected on their data dashboards that speak to use, potential abuse of opioids, and sort of different prevalence trends that, this is a source that's already current and present in use by our public health partners today. So just some hesitancy there from CDPHE. And I'll actually just deliver the feedback from BioBot as well, and then we can kind of pause for questions and see once we've taken it as a whole. I think that probably makes the most sense. So the opposing side of this conversation, I shouldn't say opposing, but different perspective, is BioBot. So again, BioBot is the testing and research organization housed out of MIT that's really kind of leading the charge in using this technology to test wastewater for a number of different communicable diseases, as well as fentanyl traces and other opioids. So, just kind of the brass tacks first and foremost, the cost of this service would be approximately $50,000 per year per location. So that location would really be the number of wastewater facilities that we have in Boulder County. That would include weekly testing of the wastewater. It would also include program support. So there's various capacities that they sort of bring in their team to assist in not just delivering the data, but helping us to incorporate it into our activities, our strategies, how we communicate to our partners in our community, et cetera. Also, BioBot sort of sees the stigma lens a little bit differently. So noting that many of their partners actually choose to do wastewater testing because it is anonymous. And it is one of the ways that we can figure out what's going on enough at a local level that we can drill down and have targeted interventions. However, at the end of the day, there are enough individuals within a community feeding a particular wastewater plant that it's essentially anonymous at that sort of individual level. Staff capacity. So this was a question that the council members brought forward and just said, what would it look like to actually participate in this concept? So primarily the capacity falls on the wastewater testing staff to pull the actual samples and then mail them into BioBot. In discussion with their team, they mentioned that, this is part of the everyday workflow of folks at the wastewater facilities already. They're drawing these samples on an ongoing basis and sending them into various compliance agencies. And so they have not found this to be of any strain to current wastewater treatment plant staff. And then in terms of county staff, so I did ask, how would this be accompanied or supplemented by, staff should the county take it on? And they said that their team does typically work with a program manager who sort of leads the effort and pulls all the pieces together, as well as an epidemiologist, usually out of the public health department, that helps kind of drive the data into, again, that public health response, or ties it to our initiatives and strategies, and also provides a little bit more of the local context to the data. So in terms of use cases, this was another question that we had the ROC ask about. So BioBot is doing wastewater testing in 400 locations, 250 counties, and all 50 states. So we did pull forward just a couple of use cases to speak to. In Marin County, California, they are currently using this testing to identify opioid spikes and trends. And they too have sort of pitched their use of this technology as something that is reducing stigma, and an approach that will actually allow them to drill down, but without actually looking at data that is not anonymized. So in Cary, North Carolina, they are looking at this at a neighborhood level and also utilizing the information to have very targeted interventions within those specific neighborhoods. The CDC, Centers for Disease Control, National Wastewater Surveillance System, as well as US HHS, are also using this technology right now to continue the monitoring of communicable diseases and spread of those diseases in certain areas. So I think it was HHS that had said in their press release that as the clinical data sort of decreases around communicable diseases like COVID or monkeypox, that there's actually the ability to draw more usable data from these sources that would allow us to still monitor traces and prevent resurgence of those diseases. So now I'm going to pause and see if there's any questions, or just kind of open it up to the group to have some conversation around this.
Susan, I see your hand up.
Yeah, Kelly, thanks so much for digging into the details around this. It's really interesting, and I appreciate the statement around kind of the stigma stuff. And I think it's something we run into with any geographical mapping that we do, is we have to be really careful about how we're messaging things and how we're using the data. That feels really important regardless of what data we have. I'm interested in, the Marin County and Cary, North Carolina, and kind of their targeted interventions. I think it's, something we're trying to do across a lot of the work is how do we stretch the dollars that we have and really target our investments to try to get to the people who are in the most need. And I see that the same in this area. So it's really interesting, and I appreciate also the flip side of some of the complications and the expense, and it's not perfect either, but really appreciate the details.
Yeah, and I'd be happy to get more information about these 3 use cases and the specific sort of interventions that they put in place around this data, if that would be helpful to kind of flesh out that picture a little bit more.
Yeah, I mean, I appreciate the other side of this, though, is that there is prescribed opioids that are going to show up as well, and there's no way to know the difference. But is there something about that can lead to use or abuse of illegal drugs, because they're so addictive, and if even targeted interventions for those people or those neighborhoods could benefit them in the long term potentially.
Lexi?
Thanks. Yeah, Kelly, I'm hoping you might be able to clarify Susan's point real quick. I've heard conflicting reports on whether the technology can distinguish between prescription opioids and um, other illegal use opioids or kind of street drugs. Um, I don't know the answer to it, but some folks that I have had conversation with have said actually the technology can distinguish between many different types of fentanyl, for instance. The other question I have is what I'm seeing on your slide is that the use cases include in all 50 states, and I'm curious if you know, is there a group in Colorado that's been using wastewater treatment tracking for opioids?
I don't know if there is specifically a group in Colorado. I do know that the BioBot team mentioned that they were working closely with the COAC at the Attorney General's office to see if there were opportunities. So it seemed like there was starting conversation around the potential partnership to really kind of move into this space. I know that some of the conversations they had mentioned were a little bit more focused on Denver as a region, so probably just trying to kind of enter the state through the most populated zone first. But I'd be happy to find out if there are, some of those are captured within, I would assume if all 50 states are reflected, there's some in Colorado. So I'm happy to figure out some more there. I will say a majority of the county level ones, when I did look, were in the state of California. And I don't know any inference of what that means, but I know that they have a strong presence in the state of California. Sorry, Robin, go ahead.
Nuria, I just put a thing in the chat, but she also passed along that CSU has developed an assay for 22 opioids and other drugs, including fentanyl. She thought, I don't want to speak for her, but what she mentioned was she thought that one sample site for these 22 would cost $1,000 per sample. So that's considerably less expensive than the BioBot. So Kelly, maybe that's something that you could follow up on as well.
Yeah, for sure. Happy to. And I should clarify too, some of these use cases, I see it says 50 states reflected. Not all of them, these are use cases around use of this technology for opioid testing. So you can see like the CDC example, that's why I included that one is really they're still using this primarily for identifying the spread of or prevalence of communicable diseases and sort of in that consideration phase about extending that use outward. So just a point of clarification.
Thank you.
I also realized, Lexi, I didn't answer your first question about the prescription opioids. I don't know the answer to that one. I know when we spoke to them, they really focused on fentanyl as something that they can pull forward. And so I think that was really an implied indication of more of an illicit sort, but I don't know if that's maybe just me trying to make that connection. I am happy to dig into that a little bit further and see what the sort of capability is there.
Any other comments? I think at this point, we're not going to make a decision either to go forward or not. I think the decision I would like to hear from the board is whether this is worth continuing to use staff time to explore to get the opioid operations group's feedback as well. It feels to me, and I may be wrong, check me on this, that there's still enough curiosity about it. And again, I think we're all grappling with, who's being impacted and then what's our response, whether it's some sort of, campaign or directing resources to a specific neighborhood or recognizing the issues of stigma. So I just wanted to check that with the group and see if there's a thumbs up to move ahead with exploration, or if people feel like you have enough information to make a determination. Given that Commissioner Levy and Naria are not available today, I would table a final vote, even if you feel like you're ready to make that decision today. Susan, was your thumbs up to continue exploring?
Yes. Yep.
Any other comments?
Just that the sense that I got from some of the communications with the state and with our public health partners in other counties is that this is an ongoing conversation that I'm not seeing folks jumping into super quickly in terms of a decision.
Thanks for that. So Kelly, I think to continue to explore and,
Yeah.
again, I want to support your capacity in terms of what you might need to continue this work. And you and I can just keep in touch about that.
Sure. Yeah, no, that's really helpful. I think, having these really specific questions come forward is, it kind of streamlines that because we're able to kind of be in communication with these teams now and just get right to the brass tacks of what's most interesting for council members to hear a little bit more about. So it's great.
So
Are there
I would invite any council member, if after the meeting is over, if a question comes up, or if you've heard something from another community or any colleagues that you want to pass on to Kelly in the meantime, that would be welcome for sure.
Absolutely. Any other questions before we move on? Okay. So another update to a conversation that we started in our March ROC meeting is around our selection process for an agency that might assist us with some facilitation, community engagement, strategic planning, and evaluation around our opioid abatement strategies. So just wanted to give a snapshot of the process so far. Some of this is a little bit repeat from last time, but some of it is new since then. We did receive 6 responses to the request for proposal, and we did take a first stab at the initial grading by staff. We took summaries of 4 of those 6 remaining that we thought were worth, having the operations group weigh a little bit more in on. We brought those summaries to the ops group in March, and we had some discussion around what's the preferred approach of this group? What are some next steps that the group sees as relevant? Would group members like to be involved in those next steps? And what are the preferred follow-up questions to have in those subsequent conversations? Then we had a similar conversation in our last meeting together and just kind of carried forward some additional questions that ROC members did want to see these finalist agencies speak to in a little bit more detail. 3 of those agencies were moved forward to interviews around the conversation and questions that came forward from both the ops group as well as the ROC. We also allowed participation from ops group members, or I shouldn't say allowed, welcomed ops group participation in those interviews and provided recordings of the interviews back to the full group afterwards. So if you were able to also weigh in who were not able to attend those interviews, but still wanted to kind of weigh in on the agencies. So these are the 3 finalist agencies that continued to the interview process. And really the conversation that we had in these interview process, or excuse me, in these interviews was the questions that this group as well as the ops group carried forward about community presence. What is the opportunity or plan for their staff and their agency to be present in the community? How do they plan to sort of engage community members and have a local context? Because if you can recall, many of these agencies were based out of state. And so we knew that that was something that was really important to hear more about. Evaluation techniques. So all 3 of these programs did apply for both the facilitation piece as well as the evaluation piece of the RFP. So we did want to hear some specific questions around evaluation technique and the approach to measure impact across not just the programs, but also the suite of programs as a whole. We also wanted to hear more from the staff that would be on the project, and so welcomed each of these teams to bring any of their staff members that would be involved in the process forward, so they could speak a little bit more to their sort of touch on the project and their credentials and experience in similar work. And then we also asked the groups to speak to their own sort of perceived barriers or challenges and how they might plan to mitigate them in doing this work in Boulder County. So our recommendation at this time is to move forward with Third Horizon strategies. So really the strengths that came out for Third Horizon were multiple. The first and foremost, they do have a local presence. They have staff that will be leading this project that live in the Denver metropolitan area. They are well-versed and immersed in the COAC and the opioid abatement efforts at the state level with the Attorney General's office. So they were able to reflect a really strong understanding of what's going on, both locally and nationally around opioid abatement. We also received some really strong references from the references that they put in their RFP. Particularly, I wanted to call forward that they were, one of their references mentioned that they thought that their biggest strength was in their community engagement approach and having a really meaningful stakeholder engagement process, and really being intentional about how they folded in stakeholder input into any recommendations or products that they created. So I thought that was pretty important to reflect, since it's come up so many times in conversation with the operations group as well as this council. In terms of their evaluation methods, they were able to speak to sort of a mixed method approach, which was really great. So first and foremost, knowing and utilizing any of the data sources that are already available within our region, as well as looking into other investigative work, projects, groups that are doing similar sort of investigations so that they can tie these efforts together. Again, that collaboration piece is something we heard come forward as a priority or value, both from this group and the operations group. Also, they were very intentional about being aware of the state's reporting requirements and or at least the timeline for which we'll be hearing a little bit more about the state's reporting requirements and how they plan to sort of roll that into their evaluation technique. They also wanted to base their evaluation on a strong understanding of each intended impact of each individual program. So, they were able to reflect this understanding that each of these programs are going to be held to a different level of outcome, process outcomes, et cetera, based on what they're really hoping to achieve, but then also how are we tying those outcomes and evaluation of those outcomes into a broader picture. And then they also were really, conscious of speaking about this from a system level. So, ways and methods that they would illuminate system gaps, looking at data gaps that are sort of known and how they use proxy measures or other supportive means to sort of fill those gaps and tell the full story of what's going on within our community. And then finally, one of their strengths was really the staff and the credentials and experience on similar bodies of work for those who would be most involved in leading this project from Third Horizon. So I want to pause and see if there's questions, any concerns with this recommendation.
I just want to remind the group that the board did say that we supported staff and the ops group to make the recommendation. But we're interested in if there's any concerns or other things that you'd like to note before we proceed with contracting. Seeing none, Kelly, I just want to commend you. Oh, Lexi, you have your hand up.
I'm sorry, I'm always just a little bit late to the game. Kelly, I'm just wondering if you have any insight and additional information on the point about their local presence and handle on local context, if you could share that.
Yeah, so their lead investigator, Mindy, I I believe it's Clouden or Clowman. I apologize for losing sight of the last name. She lives in Denver. She's been local to Denver area for a while and has been involved in opioid abatement work, addiction work, research around recovery systems across Colorado. So I'm happy to get a little bit more information. Those are the things that really stick out for me. I know that the local presence was something that both groups really echoed was super important. Mindy was able to speak to how they plan to budget to be in person for specific meetings that they knew would be better to lead in person versus ones that they thought could potentially be facilitated virtually. So it was really clear that there was some forethought into, how they were going to be as present as possible, both physically and sort of having their finger on the pulse of the local context as much as possible.
Thank you. And that's a nice alignment because as I'm looking at the website, I see that she's the managing director specifically for behavioral health. So that's a good match.
Any other questions about this decision or recommendation before we move forward?
Kelly, I just wanted to thank you and commend you and other staff as well as the ops group who participated in this process. It seemed really thorough and thoughtful. So thank you for bringing this recommendation forward.
Yeah, absolutely. We're excited to get working with them. We know we've got a lot to tackle, so I'm excited. All right, so I'm going to go ahead and move us forward with some updates from the state. And we do have Jamie Feld and Jack Patterson from the Colorado Opioid Abatement Council at the Attorney General's office joining us again. I believe they were on our February call. So just to kind of queue up some of the updates. So as a reminder, we do meet with the COAC staff as well as representatives from the other 19 settlement regions on a monthly basis on a learning collaborative call. And so just wanted to kind of, clue in the group about some of the updates that have come from the previous meetings, as well as what's coming up in May. So in March, the COAC did use that meeting to demo a data dashboard. So the dashboard really kind of covers what each settlement region is doing with their abatement dollars. It gives you an understanding of how much their funding allocation is, where they chose to sort of allocate dollars across the three main category areas. And so it's sort of driving an awareness of what's going on in other parts of the state. In April, the group hosted SE2, which is the contractor that the state has chosen to launch a statewide public awareness campaign. And we had some really good conversation around what we would like to see come from a statewide campaign and also what we would like to not see. And so these are the three questions that we had some conversation around. What do you want to see in a campaign? What would be a deal breaker in a campaign? And are there specific opportunities in your community where the campaign could have a presence? So good discussion there. I think some of the examples that came out were, make sure that you have all of your resources and materials in multiple languages. In terms of some of the deal breaker conversations, what stood out for me was any messaging that has stigmatizing or fear-based language is just kind of a deal breaker across the board for, representatives from all of the regions. And so it was a really good conversation. And then coming up in May, we are going to have a focus on fiscal and expenditure reporting, which is really exciting because we'll know a little bit more about what our obligations are in terms of what we need to pull from our recipient programs and report back to the state on an ongoing basis. Some other updates. So Jamie had mentioned this in our last meeting, but our settlement amount did go up from our recent settlement from CVS and Walgreens. Right now, our total sits at approximately 30 million, still across that 18-year arc. And then a little bit about a statewide conference that the COAC will be hosting every year in August. This will be the second year, but August 16th through 18th will be the dates for that conference this year. And there's a link if you want to provide some feedback about what would be most useful for you to hear more about at that event. So that said, I'm going to pass it off to Jamie and Jack to sort of expand or add anything I missed.
Kelly, I think you got it all. So that was a great update, and I'll let Jack say if there's anything more, but I just want to reiterate our appreciation for Boulder County staff participating so actively in our regional forums and being so responsive. We also appreciate Boulder County staff assisting with the recent participation forums that we had to gather around the state. All the participation forums were gathered for Boulder County region, including Jamestown, which is notoriously difficult to reach. So really just a huge kudos to your staff and to all of Boulder County for the active collaboration. And please just let us know if there's anything we can do for technical assistance. We have a great team. Jack Patterson, who's here on our team, is very responsive and manages our opioids email. And so if one of us doesn't know the answer, we'll get you to the right folks. I did put the link to our dashboard in the chat. Once we get more information about every part, we'll let you know as soon as possible, particularly around the settlement numbers, the expenditure reporting process. But we really are working frontline with your regional primary contacts, which is Kelly, Jim Adamsberger, to relay this information to you all. So again, thank you for the work you're doing. We're excited to see the next steps with you hiring this facilitator. And then please let us know, as a former Boulder County employee, I just always love hearing about the great work you're doing. So we look forward to staying tuned in. Jack, is there anything I missed?
No, I think Kelly, I think got pretty much all of our updates as I think just a testament to how engaged Boulder has been with the state efforts. And I just again would shout out both to Kelly as well as to Bob Halpin and Jim for all the assistance, as well as all the other additional support staff for the continued partnership, especially with these opioid settlement forms. So thank you all, and please do not hesitate to reach out if we can be of any additional assistance.
Thanks, Jamie. Thanks, Jack. Sorry, I just meant to cue it up and then I just kept talking.
I think actually the only other things to mention are the state will be, Jamie, if you want to touch on the infrastructure and innovation part.
Yes, so we will be sending out a notice through our newsletter about 2 funding opportunities. One is the infrastructure share and one is the innovation share. They have our Colorado Opioid Abatement Council, which oversees the infrastructure portion, has made a slight amendment to the policy to recommend not only underserved, but also rural communities for the infrastructure share. That will be posted early May and go out through our newsletter. And then another complementary funding opportunity is the innovation grant. And this is an exciting new funding opportunity that comes out of our state share to fund innovative models to address the opioid crisis. There's going to be 3 funding tiers, small, medium, and large. And I think, Boulder that might be one area you want to think about, as Boulder often pilots innovative projects to address this. You can include in it why it's innovative, as well as maybe if you have any anticipated evaluation to show how this could be replicated in the state. That will be also launched in May on our website and through our newsletter. We'll have to be a little bit radio silence once it goes live May 1st, but there'll be information from our procurement team if you have questions, in a question and answer period, as well as office hours for each of those funding opportunities. So those are all meant to supplement regional funds. So in addition, this would be in addition to your regional council funds. And one thing to note is that part of the application for infrastructure is that it recommends that applicants reach out to the regional opioid abatement councils first to get a letter of support before applying, because we really want to, especially for the infrastructure, ensure that the regional council has some awareness of these applications. And the last piece about that is that the infrastructure is available only for the regional councils and governmental entities, whether state, local, participating local governments, counties. The innovation will be open to those entities as well as nonprofits and for-profits, most likely. So a little bit broader. Again, yeah, more information to come, but particularly for the innovation grant, I think that might be something this group might be interested in.
Jamie, what are the due dates for those opportunities?
once they're launched, the due dates will be specified, but I'm anticipating that our grants coordinator will put end of June for both of them. So launch probably early May, due date end of June.
Yeah, it just matters to us for being able to have a discussion about what we might submit.
Mhm.
And, you know, figuring out that timing.
Yeah, any thoughts about that? They have not been finalized, those due dates. I'd be curious, is 2 months seem feasible for, from your perspective?
Well, I think that's plenty of time to submit an application, but the issue with us is with monthly meetings,
Yep.
we would have to have that discussion prior to a submission.
Mm-hmm.
So that's the timing issue for me. That's
Yeah.
what happened to us for the last round.
Yeah. We have, I think the finalized version will say that that the letter of support is recommended, strongly recommended, but not required. Understanding that a lot of councils won't be able to meet in that time frame, and then the applicant could put a reason why they didn't. But that is specified in the current version that it's not required, and that they could say, you know, because the committee doesn't have time to meet and approve prior to the submission.
Thanks for that.
Yep. Great.
I don't want to put you on the spot, but we had a previous conversation about the wastewater testing for opioids. And I think you've been involved in some of those conversations. Kelly provided a great overview of, you know, sort of the pros and cons, including reaching out to the MIT group as well as CDPHE. Some council members had some other thoughts. We're going to continue to explore it, but I didn't know if there was anything you cared to mention.
You know,
Or not.
I'm hesitant because I'm not wearing my like my background as an epidemiologist. I'm not wearing that hat in this current role. I think my one thought around it, having seen the response from CDPHE, you know, is that there are some other surveillance mechanisms that are already in place, like the syndromic surveillance, that might not be fully used to their existing potential. And so, you know, sometimes, at least when we were considering whether we would fund it at the state level, we thought, like, are we even using our existing surveillance for actionable items like timely syndromic surveillance, which gives you, you know, emergency room visits. And then there are some concerns, I think, with wastewater around it not being able to differentiate between opioids for treatment, like Suboxone, versus opioids for, you know, misuse or as prescribed. And so I think those are some limitations to using it as like an actionable surveillance tool. And I think too, the last thing is that there is, you know, staffing capacity issues with it, just as with any surveillance system. But I think it's always interesting to pursue it a little bit further. And I know, yeah, Lexi Nolan and your commissioner reached out to us when she was the mayor of Lafayette, and we did start some conversations with BioBot. So always interested to continue those conversations.
Thanks.
And then I think yeah, go ahead. Sorry, Robin.
No, I was just thanking you.
Okay. I would say the last comment is that we have not at the state like finalized a really great, robust surveillance system, at least from the Attorney General's office. So I do understand kind of the need or the desire from locals to get ahead of it, because at the state we don't have a finalized version available. So I do understand that interest.
Any other questions for Jamie or Jack, or comments? Okay.
I think that was it for us. So we might have a big gift of time here, unless there's other items for the good of the group. Yeah, Lexi, it was around 17 million, at 17.5-ish million.
Any other input or announcements or updates from any of the council members that they'd like to share? I saw a public notice that the city of Boulder's council meeting on Thursday is going to have an update on, specifically on meth. So that'll be interesting. Lexi, are you participating in that?
We are.
Okay, well, not seeing any more comments. Thanks, everybody, for your continued engagement and for the discussion today. We have one more meeting scheduled, so you'll be receiving an email from me trying to schedule the next 2 months for June and July. It's a difficult group to schedule, but I'm always going to try my best to get at least 2 meetings on the books at a time. So thanks again and have a good rest of your day and week. So long.
Thanks, everyone.